Good evening, friends. Welcome to the chanting session for FMGE Biochemistry session. Yes. So in previous session we discussed something about lipoproteins. Lipoprotein chylomicrons. Yes, chylomicron and HDL. In this the size decreases. Means chylomicron. Yes, if you see the name of chylomicron itself, it is very big name, so it is having largest size. Okay, HDL is having highest density. Highest density means more compact, smallest in size. Question: if you do electrophoresis, question is asked, electrophoresis, highest movement. Yes, this is HDL. How to remember? Highest movement, HDL. Okay. Let me check. Yes. Okay, if you have any doubt you can ask. Yes, so high density lipoprotein, highest movement, this is chylomicron. सबसे कम, C4 कम, सो सबसे कम मूवमेंट किसके होंगे? काइलोमाइक्रोन के. सबसे ज़्यादा मूवमेंट किसके होंगे? हाईएस्ट मूवमेंट. यस हिमांशु, आई एम फाइन. सबसे ज़्यादा मूवमेंट HDL के होंगे इलेक्ट्रोफोरेसिस पे. सबसे कम लीस्ट मूवमेंट काइलोमाइक्रोन. ओके, नाउ स्ट्रक्चर बेस्ड क्वेश्चन. प्यूरीन बेस, mnemonic for this is pure as gold. A for adenine, G for guanine. In this purine base, name is small, but rings are 2. Question has been asked on the structure. They will give structure and they will ask you this is adenine or guanine. How you will remember? A for adenine, A for amine. A for adenine, A for amine. If on the top, yes, if amine is there, this is adenine. If on the top keto group is there, yes, this is guanine. So 2 are there, you can easily differentiate at the top, or only amine is there, A for amine, A for. Dr. Mark, hello, very good evening. Adenine. Okay. Pyrimidine, name is large, नाम बड़ा है, नाम बड़े और दर्शन छोटे. Yes, only one ring is there. So structure MCQ आ रहे हैं तो टिपिंग, so they can ask. Mnemonic is cut, CUT, cut means एक रिंग कट कर दी हमने. कितनी रिंग बची? Only one ring is left. If one ring is cut, one ring is left. So if one ring is there, this is pyrimidine. If 2 rings are there, this is purine. Okay. If amine group only, adenine. If keto group extra, guanine. CUT, cut. How to remember? Cytosine is having amine group. Cytosine is having which group? Amine group. And whenever amine group is removed, yes, here amine group is removed, there is keto group. So amine group is removed, there is keto group. So even if you don't remember, it's okay. Simple mnemonic. Look at the screen. U2O. Yes, U2O. If structure is given to you, yes, you will see these 2O, 2 keto group, uracil, U. Okay. If amine, cytosine. If methyl group is there, methyl, thiamine, methyl, thiamine, methyl is thiamine. Okay, so you can see this is about purine and pyrimidine ring. Base plus sugar, base plus sugar, S for sugar, S for side, nucleoside, S for side, base plus sugar. Yes, you can easily remember nucleoside. Nucleotide, ti means tri. Three things are there. Three things are there. Base plus sugar plus phosphate, nucleotide. Base plus sugar plus phosphate, nucleotide. Now, this question was asked, clinical picture pathognomic of which dyslipidemia? I am doing randomly. Okay, questions are asked randomly. So, yes, this is Tanger's disease. Tang. Yes, you can see tang. Which color? Orange color. Yes, this is orange color tonsil. Question is asked. Sometimes you will find orange color tonsil. Orange color tonsil. Okay, so orange, most common flavor of tang is orange flavor. So Tangier disease. Okay, so you will remember like this, mnemonic. Purine catabolism. Purine, this purine catabolism. Yes, very good, Himanshu. You have given the correct answer. Purine catabolism, this adenine and guanine, if they catabolize, question is asked, and product of purine catabolism is uric acid. And product of purine catabolism is uric acid. And question is asked that one enzyme, the name of enzyme is HGPRT. What is the name of enzyme? HGPRT. If this enzyme is deficient, then Leishman syndrome. Lash means eyelashes. Lash means eyelashes. Nayan matlab eye. Okay, so X-linked recessive. X-linked recessive. Question is asked, Leishman syndrome is X-linked recessive. In this symptoms, gout, uric acid increase. If uric acid increase, that is gout. And self-mutilation means self-injurious behavior. Patient will injure himself. Self-injurious behavior. This question is asked, picture MCQs is asked, are asked. Yes. Yes, sometimes they give picture like this, self-injurious behavior. Very good. This means patient will cut his lips, fingers. That is HGPRT deficiency, Leishman syndrome. Self-mutilation. Very good, Himanshu. Yes, few points about genetics. A question is asked, recently asked question, telomers or telomers. Yes, what is the sequence of telomere? T for telomere, T for TTAGGG. TTAGGG. This is telomere. Okay. Multiple time. These are found at the linear end of chromosome. These are found at the linear end of chromosome. So question is asked on telomere, TTAGGG, TTAGGG, TTAGGG. After each cell division, a small portion of DNA is lost. What I said, after each replication or after each cell division, small portion of DNA is lost, and the lost portion is telomere. So number of telomere decide the number of division. Number of telomere decide the number of division. Means after each replication, suppose one telomere is lost, suppose one telomere is lost, and a cell is having 60 telomere. So how many times this cell can divide? 60 times. So depending on the number of telomere the cell can divide, this is called Hayflick limit. Question was asked. Hayflick limit. Okay, I am compiling all the handouts, whatever I have done till now. I will try to put on our Telegram channel. Yes, definitely it is little bit random or was not planned to distribute, but now I am compiling and taking the screenshot, and I will put on the Telegram channel, so don't worry about that. Now, telomerase, we found that germ cell. So Hayflick limit question is asked. You all know germ cell divide continuously. When germ cell divide continuously, yes, anonymous, good evening. Yes, so we found that cancer cell and germ cell which divide regularly, they have telomerase activity. What I said, telomerase activity, and telomerase synthesize telomer. Question is asked, telomerase synthesize telomer, and this telomerase is DNA. Okay, yes, it is this Telegram group of DBMCI. I would be active on this, and on daily basis I will put some question. Okay, so I have, yes, you know that initially it take a little bit time to organize something, but now I have taken care of this segment of FMG, and I will organize a little bit in a better way. So on the Telegram channel given in the link, I would be active on that channel, and just few questions are put. Now I will try to put more and more clinical questions on it. Yes, anonymous, good, that RNA dependent DNA polymerase. Yes, telomerase is RNA dependent DNA polymerase, that is reverse transcriptase. Reverse transcriptase. Reverse transcriptase. Okay, so I don't solve this question, no need. Simply remember and tell me the answer of this question. The base sequence of coding strand of DNA used for transcription has the base sequence GTG. What is the base sequence of RNA product? Yes, please do answer. Yes, look at me. In double-stranded DNA, suppose this is double-stranded DNA, look at me. This is one strand, second strand. Two strands are having 5 end, this is 5 end, this is 3 end. So two strands are anti-parallel. Question is asked, in DNA, two strands are anti-parallel, means 5 end is against 3 end, 3 against 5 end. 2 out of 2 strand, one strand is called coding strand, other is called template strand. In this question they have given, look at the screen, they have given coding strand. Yes, coding strand. They want to ask what is the RNA. Yes, this coding strand has order, information. It ordered template strand, go and make messenger RNA just like me. So this template strand will synthesize messenger RNA just like coding strand. What I said? Template strand synthesize messenger RNA. Who synthesize messenger RNA? Template strand. And this messenger RNA should be just like coding strand. So this is coding strand, GTG, This coding strand gave order to template strand, go and make a messenger RNA just like me. So this coding strand will give order to this template strand. Template strand will synthesize messenger RNA just like coding strand, except T will be replaced by U. C G A U C G 5 3. So answer is GUG. Answer is GUG. Okay, if you forget it, I say forget it, just remember the mnemonic. If they have given coding strand, remember the mnemonic. If they have given coding strand, write the same sequence except T is replaced by U. What I said? If they have given coding strand, this is coding. Same, write same sequence except T is replaced by U. So answer is B. Understood? Himanshu, got the point? Now, this is mutation. Let me tell you the mutation. Yes, mutation. What is mutation? If nucleotide is changed, there are 64 codon. How many codons are there? 64 codon. Out of 64 codon, 3 are stop codon. Which are stop codon? Yes, UAA, UAG, UGA. You are away, you are gone, you go away. 3 stop codon. You are away, you are gone, you go away. 61 codon code for 20 amino acid. Okay, code for 20 amino acid. Yes, one question in mitochondria. Yes, mitochondria, stop codons are. Yes, any idea? Mnemonic is Agarwal. Yes, AGG. Yes, or AGA. So both Agarwal are stop codon. Okay. Yes, I speak many times silently. Actually, my wife is Agarwal. Okay. If she will hear me, she will stop me. Okay. Yes. So my wife is Agarwal. Mitochondria. Yes, AGA and AGG. That both are stop codon. 61 codon code for 20 amino acid. Very. Yes, Kostub is here. Yes. Yes. So if I take average 61 divided by 20, on an average 3 codon for 1 amino acid. Yes. Yes. You are well aware, Himanshu. Yes. On an average 3 codons for 1 amino acid. यानी एक अमाइनो एसिड के 3 कोडोन. Yes. So more than 1 codon for single amino acid, it is called degeneracy of codon. Question: degeneracy of codon. Yes, more than 1 codon for single amino acid, that is degeneracy of codon or redundancy of codon. Redundancy of codon. This question was asked about Wobble hypothesis. Yes, what was the question? Let me tell you. Yes, recently asked question. If I say UCA is a codon coding for serine, UCU again code for serine, UCU code for serine, UCA code for serine. Is it possible? Yes, I told you 3 more than 1 codon for single amino acid. This is called redundancy of codon or degeneracy of codon. Yes, it is possible. So we found that, look at this, in this UC are same, A is replaced by U. UC are same, A is replaced by U. Means the third nucleotide is changed. If you change third nucleotide, there are chances that new codon code for same amino acid, okay. Yes, if you change third nucleotide, there are chances that new codon code for same amino acid, okay. Means UCA UCU same. This is Wobble hypothesis. Means third nucleotide of a codon is not so specific. Means if you change the third nucleotide, there are chances that the new codon may code for same amino acid. Yes, question was asked in INICET. Yes, Wobble hypothesis can be explained by. Yes, they are asking difficult question, I know, but Wobble hypothesis can be explained by degeneracy of codon, means more than 1 codon for single amino acid. And if one codon is replaced by same means different codon coding same amino acid, this is serine, then this is called silent mutation. If UCA is changed to CCA, means serine is changed by proline, one amino acid is changed by another amino acid, this is called missense mutation. And if UCA is changed to UAA, UAA is stop codon, code for nothing, so nonsense mutation. Let me repeat, this is very potential topic, recently asked topic. 3 stop codon, if any codon is changed to stop codon, then it is called nonsense mutation. If one codon coding for one amino acid is changed with other amino acid, missense mutation. If one amino acid is changed to another amino acid, silent mutation, okay, clear. And there are 64 codon. Out of these 3 stop codon, 61 code for 20 amino acid, more than one codon for single amino acid. This is called degeneracy of codon. If third nucleotide is changed, there are chances that next codon code for same amino acid. This is Wobble hypothesis. Clear? So I don't solve question. Yes, you all are aware. Now this is question Farber disease, mnemonic Farber or barber cut hairs of सिर के बाल काटता है, तो ceramidase. Which enzyme is deficient? Ceramidase is deficient. ceramidase Farber disease. If a person is cutting hair since morning to evening, his small joints would be painful. Yes, painful small joint, painful small joint like rheumatoid arthritis, rheumatoid arthritis. Yes, please give me feedback that in the next session should I discuss more and more questions rather than, yes, question based approach rather than this text. Yes, I want your reply. Yes, I want your reply. Yes, more and more question based approach would be better, or this is, yes, rheumatoid arthritis like, yes. Yes, now the following histopathological picture on bone marrow examination. Yes, this is crumbled tissue paper appearance. Crumbled tissue paper appearance, that is crumbled tissue paper appearance, that is Gaucher's disease. That is Gaucher's. Yes. Yes, next time is PEDS. In PEDS, I will do more and more questions. Okay, question based approach. I'm thinking like that. That would be a better approach. Okay, so from PEDS onward, I will give you more and more question. Yes, and we will not stop here as we have targeted June FMG. So in the last we will do continuous chanting. Okay, means when your course, whatever, wherever you are doing any coaching or, okay, yes, anonymous gave its own thought, so her own thought or his own thought. So we will in the last, before the exam, yes, we will do more and more chanting, continuous chanting, more questions, so that we will be in flow. Okay. Yes, Gaucher's disease, which enzyme is deficient? Yes, beta glucosidase. Beta glucosidase. Fabry's disease, which enzyme is deficient? Alpha galactosidase. Alpha galactosidase. Niemann-Pick disease, which enzyme is deficient? Niemann-Pick disease, neem soap. Soap means sphingomyelinase. Sphingomyelinase is deficient. Okay. Sandhoff disease, hexosaminidase. Hexosaminidase A and B. Yes. Yes, definitely. Hexosaminidase A and B both are deficient in Sandhoff disease. Okay. Yes. Tay-Sachs disease. Tay-Sachs disease. Which enzyme is deficient? Please do reply. Tay-Sachs disease, which enzyme is deficient? In Tay-Sachs disease, hexosaminidase, yes, hexosaminidase A. Hexosaminidase A is deficient. How to remember? Mnemonic. Mnemonic is TSH. Mnemonic is TSH. T for Tay-Sachs disease, T for Tay, S for Sachs, H for hexosaminidase. SH, Sandhoff disease, hexosaminidase A and B. So how will you remember that in which A and B both, or in which only A? If you spell 2F In Tay-Sachs disease, you will not find two letters, but here 2F, so both A and B are deficient. Okay, now I have deliberately rubbed it and now it is looking like X. It is alpha galactosidase is looking like X. All these are autosomal recessive except Fabry's disease. Yes, these three are autosomal recessive, but Fabry's disease is X-linked recessive. Fabry's disease is X-linked recessive. So before going further, yes, let me revise fast whatever we have read. Okay, revision is the rule of, yes, remembering. Yes, if you want to remember purine, adenine and guanine, adenine A4 amine, guanine, keto group is there. 2 rings are there, name छोटा है और 2 rings है. pyrimidine नाम बड़ा है, ring एक है. CUT cut, yes, only 1 ring. A4 amine, cytosine. U looks like, yes, this mouth, ये face, okay. 2 keto group, uracil. If methyl group extra, methyl thiamine. Base plus sugar nucleoside, base plus sugar plus phosphate nucleotide. Okay, purine catabolism, question is asked, purine catabolism and product is uric acid. If HGPRT deficiency, lash eyelashes, yes, X-linked recessive, eyelashes X-linked, lady से related है, X-linked recessive. इसमें क्या होता है, self mutilation होता है. Which enzyme deficient? HGPRT. Yes. ऑरेंज कलर टोंसिल, ऑरेंज फ्लेवर टैंग का होता है. तुमने टैंग बहुत सारा पिया है, यू हैव टेकन टैंग. टेंजियर डिजीज, टिपिकल पैथोग्नोमिक. काइलोमाइक्रोन, नेम बड़ा है, सबसे बड़ा, लार्जेस्ट. हाई डेंसिटी, सबसे हाई डेंसिटी, बट इट इज कॉम्पैक्ट, स्मॉलेस्ट. ऑन इलेक्ट्रोफोरेसिस, हाईएस्ट मूवमेंट HDL, सबसे कम मूवमेंट काइलोमाइक्रोन. ओके, यस. टीलोमर टेल कहाँ पे होती है, एंड पे होती है, यानी कि क्रोमोसोम के एंड पे क्या होगा, टेलमर. TTA GGG मल्टीपल टाइम. हर डिवीजन के बाद टेल छोटी हो जाएगी और एवरी डिवीजन टेल इज स्मॉल. तो जितनी टेल होगी उतने डिवीजन, उसे कहते हैं हेफलिक लिमिट. लेकिन वी हैव टीलोमरेज एंजाइम इज प्रेजेंट इन कैंसर सेल एंड जर्म सेल. टीलोमरेज एक्टिविटी इज इंक्रीज्ड इन कैंसर सेल. ओके, एज के साथ टीलोमरेज एक्टिविटी कम हो जाती है. Whenever you are asked on messenger RNA, if coding strand is given, you will write the same sequence except T is replaced by U. More than one codon for single amino acid, this is called degeneracy of codon. UCA code for serine, UCU code for serine. ओके, यदि सेरीन से सेरीन रिप्लेस, साइलेंट. सेरीन से प्रोलीन, अमीनो एसिड चेंज हुआ, मिस सेंस म्यूटेशन. सेरीन से स्टॉप कोडॉन, नॉन सेंस म्यूटेशन. यस. फार्बर डिजीज, सिर के बाल, सेरामाइडेज. Clinical question, you will find clinical question, so many points will be given and you will find small joint pain like rheumatoid arthritis. Answer would be ceramidase deficiency, Farber disease. Gaucher disease, crumbled tissue paper appearance. Fabry's disease, yes, X-linked recessive, alpha galactosidase, alpha का ये काट कर दिया हमने, X लगा, बाकी सब autosomal recessive. Mnemonic TSH, Tay-Sachs disease, hexosaminidase A. Sandhoff, hexosaminidase A and B. Niemann-Pick sphingomyelinase is deficient. Okay. Hunter's disease, yes, Hunter's disease. You must have gone for hunting. Yes, नहीं गए, कोई बात नहीं. If you are going for hunting, you must have seen many Hindi movies that just like these guns and lion. Yes, face of lion. You must have seen, but यहाँ हमने lion का face नहीं लगाया. Hunters are usually male, तो it is more common in males. It looks like X. Hunter's disease is X-linked recessive. दो गन है तो MPS टाइप 2, MPS टाइप 2। कितनी गन्स हैं? दो, MPS टाइप 2। और याद रखना, इफ़ यू आर गोइंग फॉर हंटिंग योर विजन शुड बी वेरी शार्प, विजन शुड बी शार्प, अदरवाइज यू विल बी हंटेड, ओके बाई लायन। लॉयन तुम्हें ही खा जाएगा, तो इसलिए विज़न बिल्कुल क्लियर होनी चाहिए। नो कॉर्नियल क्लाउडिंग क्वेश्चन आता है, हंटर्स डिजीज़, नो कॉर्नियल क्लाउडिंग, हंटर्स डिजीज़, क्लियर। नाउ फैटी एसिड सिंथेसिस एंड बीटा ऑक्सीडेशन ऑफ फैटी एसिड, ये टॉपिक हमने शायद टच नहीं किया था। यस, फैटी एसिड सिंथेसिस अकर इन फैड स्टेट। फैटी एसिड सिंथेसिस कब होती है? फैड स्टेट। बीटा ऑक्सीडेशन ऑफ फैटी एसिड अकर इन starvation. Question is asked, in fatty acid synthesis most common fatty acid to be synthesized is, most common fatty acid कौन सा होता है? Palmitic acid. How many? Yes, please do reply. How many? Yes, how many carbon in palmitic acid? Stearic acid, how many carbon? Yes, answer please. Palmitic 16 carbon. Stearic S looks like 8. Stearic 18 carbon. If you don't remember, you can remember like this. Palmitic acid, if we count, sometimes we count like this: 1 2 3 4 5 6 7 8 9 12 15, and palm is 16. Palm is 16. So palmitic acid, how many carbon? 16 carbon. Very good, anonymous. Kostub, yes, very good. Now complete oxidation, beta oxidation of palmitic acid beta oxidation produce how many ATPs? Please do reply. How many ATPs? Yes, 16 carbon oxidation. 16 carbon oxidation, you just put O of oxidation here. Palmitic acid 16 carbon oxidation, put this oxidation O here and you will find 106 ATP. Very good, anonymous. Kostub, net gain of, sorry, there are two questions. You can, net production is 108, but net, or you can say production is 108 but net gain is 106, because 2 ATP were used in the activation of fatty acid. Okay dear, yes, you will remember this. This is mitochondria. This is mitochondria. Okay, this is mitochondria and this is outside it cytosol. Now if I ask you, I write here, this is ketone body synthesis, this is cholesterol synthesis. So cholesterol synthesis occur in fad state, ketone body synthesis occur in starvation. Ketone body synthesis occur in starvation, cholesterol synthesis occur in fad state. Two acetyl coenzyme join to form acetoacetyl coenzyme, then HMG coenzyme. These two steps are common in ketone body synthesis and cholesterol synthesis. So the common enzyme HMG coenzyme synthase. This question was asked. Enzyme common to cholesterol synthesis and ketone body synthesis is HMG coenzyme A. That this HMG coenzyme A is formed both in cholesterol synthesis and ketone body synthesis, and the enzyme common to both is HMG coenzyme A synthase. This question was asked. Okay, there is an enzyme thiolase. So next time they can ask this question. This is also common in cholesterol and ketone body synthesis. Cholesterol synthesis occur in cytosol. Ketone body synthesis occur in mitochondria. Yes. Now, fatty acid synthesis and beta oxidation of fatty acid are two opposite pathway. What I said? Fatty acid synthesis, if I say acetyl coenzyme A, two acetyl coenzyme A or multiple acetyl coenzyme A join to form palmitic acid. That is fatty acid synthesis, and palmitic acid is beta oxidation acetyl coenzyme A. This is beta oxidation. This is fatty acid synthesis. These are two opposite pathways. These are two opposite pathways. Why I am telling you like this? Because questions are asked on the sequence of enzyme. Fatty acid synthesis, the sequence of enzyme is reductase, hydratase, reductase. Reductase, hydratase, reductase. While in beta oxidation, reductase का opposite क्या होता है? Dehydrogenase. Reduction, dehydrogenase means oxidation. Dehydrogenase means oxidation. So these beta oxidation and ketone body synthesis, beta oxidation and fatty acid synthesis are exactly opposite. So their enzymes are exactly opposite. So you will remember reductase, hydratase, reductase, dehydrogenase, hydratase, dehydrogenase. Clear? Yes, very good. If diverted to carbohydrate cycle, then 80 ATP. Yes. Fed state and starvation, anonymous. Very good. Yes. Ketone body synthesis questions are asked. Yes, ketone body synthesis occur in starvation and diabetes. Starvation and diabetes. So you will find question that a patient comes to emergency, medical emergency, urine test done for ketone bodies and for glucose. Ketone bodies के लिए Rothras test. Which test? Rothras test. Glucose के लिए you can do multiple test. One of them is Benedict test. Benedict test positive, Rothras test positive. Yes. Then urine sample लिया तुमने. Okay. Please do reply. Yes, please do reply. Very good. Thiophorase is absent in liver. Very good. Yes, please do reply. क्वेश्चन आया कि कीटोन बॉडीज और ग्लूकोज के लिए तुमने रोथरास टेस्ट भी पॉजिटिव है, बेनेडिक्ट टेस्ट भी पॉजिटिव है, तो ये स्टारवेशन है या डायबिटीज? इफ बेनेडिक्ट टेस्ट इज पॉजिटिव मीन्स रिड्यूसिंग शुगर इज देयर. रिड्यूसिंग शुगर इज देयर मतलब ग्लूकोज इन यूरिन मतलब डायबिटीज. Yes, very good, anonymous. Diabetes. If Benedict test is negative, Rothras test is positive, then it is starvation. Clear? Now, yes, very good. Ketone body synthesis, I have already told you, HMG coenzyme synthase, rate limiting enzyme. First ketone body to be synthesized is acetoacetate. Question. Most common ketone body present in blood is beta hydroxybutyrate. Beta hydroxy, B for बहुत सारा, big amount. Big amount. Yes, you all know that ketone bodies are very toxic. Even then, ketone bodies are very toxic. Even then, liver synthesize ketone body. Why? Most vital structure, brain, heart, and skeletal muscle utilize ketone body in starvation. Question. Okay, but liver is the organ which can synthesize ketone body but can't utilize ketone bodies. Liver is the organ which can synthesize ketone body but can't utilize ketone body due to deficiency of which enzyme? Yes, Kostub already has given answer. Due to deficiency of thiophorase. Yes, ketone body utilization, the enzyme thiophorase is required. Liver is deficient of thiophorase. Okay. Now, one more question. microRNA. Yes, microRNA is 21 to 23 nucleotide long. Yes, कितना न्यूक्लियोटाइड होते हैं इसमें? 21 to 23. Suppose this is messenger RNA 5 and this is 3 end. microRNA bind to which end? This is suppose microRNA. Yes, I usually say M looks like 3. So question was asked, microRNA bind to 3 untranslated region, UTR. Question. And binding to messenger RNA, it cause gene knock down. Okay, knock down. 3 words are there. Gene knock out, gene knock in. If you don't understand the meaning, even then you can tell me the answer. microRNA M W. ठीक है, तो knock down. Yes, knock down is having just like M. Okay, so you will remember gene microRNA is not going to do gene knockout or in. It is going to do gene knock. Yes, gene knock, not knockout. Kostub, it is going gene knock down. Okay, how? That's why I am telling you M. Remember these small point. M down, DOW. ओके, उल्टा M W. M को रोटेट करो 3 अनट्रांसलेटेड रीजन पे बाइंड होता है और जीन नॉक डाउन करता है, नॉक आउट नहीं करता. कौस्तुभ करेक्ट इट. ओके, सो माइक्रो आरएनए पे क्वेश्चन आए हुए हैं 2 अभी रिसेंटली. ठीक है, ओलाइगोमाइसिन Oligomycin inhibit which portion? Yes, F0 or F1? F0. F0 is H ion channel. F0 को लाइगेट किया, F0 को क्या किया? लाइगेट किया, O को लाइगेट किया, निमोनिक ओलाइगो, O को क्या किया? लाइगेट। सो ये क्या बंद हो गया? ये बंद हो गया। सो ADP से ATP बंद हो गया। Yes, if F0 is inhibited, this is complex 5 is inhibited, so phosphorylation inhibited. Question was asked, which of the following compound inhibit, yes, oxidative phosphorylation? And the answer was oligo. Yes, good. कौस्तुभ ने करेक्ट नहीं किया, नॉकआउट, नॉक डाउन कर कौस्तुभ। ओके, यस, कॉम्प्लेक्स 5 का पार्ट है। यस, दिस इज कॉम्प्लेक्स 5। ओ को लाइगेट किया, चैनल को बंद कर दिया। यस, दिस इज ओलिगोमाइसिन। यस, साइटोक्रोम सी, साइटोक्रोम सी if present at inner mitochondrial membrane, it gives life, electron transport chain. A question was asked, cytosolic cytochrome C mediate, yes, any idea? Mediate apoptosis. Yes, if cytochrome C is present at inner mitochondrial membrane, then what it do? If cytochrome C is present at inner mitochondrial membrane, it gives life, it do electron transport chain. But if it dissociate and reach the cytosol, then it cause apoptosis. It cause apoptosis. Clear? Yes, complex 1 question is asked, is inhibited by rotinone, ONE1, name itself tells you, rotinone, ONE1. Okay, now urea cycle, urea NH2CO NH2 NH2CO NH2, one nitrogen come from ammonia, carbon come from CO2, second nitrogen comes from, please do reply, second nitrogen comes from, yes, very good, please do reply. Second nitrogen come from aspartate, aspartate participate, aspartate participate in urea. Okay, and in urea synthesis, first enzyme CPS1 is present in mitochondria and for urea cycle. CPS2 is present in cytosol, CPS2 is present in cytosol, and yes, and it is for pyrimidine synthesis, pyrimidine synthesis. Okay, now a question was asked, connecting link between urea cycle and Krebs cycle, fumarate, and this is fumarate. Yes, fumarate is both part of urea cycle and Krebs cycle. Connecting link between urea cycle and Krebs cycle is fumarate. Clear? Yes. Now a question was asked, which amino acid connect urea cycle with Krebs cycle? The answer was aspartate, because aspartate can be easily converted to oxaloacetate. So let me revise fast. Urea cycle, NH2CO, NH2, nitrogen, first nitrogen ammonia, carbon CO2, second nitrogen aspartate. Yes, aspartate is connecting link. Yes, which amino acid connect urea cycle and Krebs cycle? Aspartate. Which compound connect urea cycle and Krebs cycle? Fumarate. Best answer. Yes, oligomycin inhibit complex 5 F0, so inhibit oxidative phosphorylation. Yes, माइक्रो आरएनए एम याद रखना 3 अनट्रांसलेटेड रीजन में बाइंड करता है, जीन नॉक डाउन करता है. ओके, लीवर सिंथेसिस कीटोन बॉडी सिंथेसाइज करता है लेकिन यूटिलाइज नहीं करता, क्योंकि कौन सा एंजाइम डिफिशिएंट होता है? थायोफोरेज. रेट लिमिटिंग एंजाइम कीटोन बॉडी का एचएमजी को एंजाइम सिंथेस. लार्जेस्ट अमाउंट ऑफ कीटोन बॉडी बीटा हाइड्रोक्सी ब्यूटारेट. If ketone body and glucose both are present, then it is diabetes. If only ketone body, yes, starvation. Fatty acid synthase and beta oxidation opposite. That's why enzymes are opposite. Reductase, hydratase, reductase. Sequence पे question आता है. In beta oxidation, dehydrogenase, hydratase, dehydrogenase. Palmitic acid 16 carbon, beta oxidation एक oxidation O का बो यहाँ पे लगा दो 106 ATP. Okay. Hunter's disease, corneal clouding, no corneal clouding in Hunter's disease. No corneal clouding in Hunter's disease, X-linked MPS type 2. Yes, Farber disease, I think we have revised most of the things. So, I know 3 hours are much less for biochemistry, but we will remain connected in another way. I will try to spare some time and to post more and more question on Telegram group, so that the subject which will cover, we will try to put on questions on that Telegram group. So just give me 2-3 more days to organize everything, then it would be little bit more productive. So let me finish the discussion with saying that remain positive, remain motivated, work hard, never feel hopeless, helpless. Okay, so best wishes. We'll meet in next session with Pete's with more mnemonics. Okay, good night.